Welcome back. The time is now 7:45 and the COVID-19 vaccine is starting to become more available in our area as hospitals and nursing facilities are getting their healthcare workers vaccinated. Plus, a new vaccine is currently undergoing phase 3 trials right now. So with all of this news, people are deciding if they want to get the vaccine once it becomes available. However, there are still a lot of questions about its effectiveness. So for professional advice, we decided to turn now to Dr. Renee Bullock-Palmer. She is a cardiologist at the Deborah Heart and Lung Center. So thank you so much for waking up early this morning. Appreciate having you on the show.
Thank you, Demetria. Good morning.
So first, I want to just start off by you explaining how getting the vaccine is actually going to protect our individual health.
Right, so getting this vaccine is very important. These vaccines are based on mRNA, and these vaccines essentially gives the body the instructions to make the necessary antibodies to fight this virus if you're faced with this virus. So that's how it protects the body. And of course, the goal is that we're hoping that at least 70% of the U.S. population will eventually become vaccinated. And at that point, hopefully, we'll start to see the decline of the pandemic.
Yeah, that's a good hope as well. So what do we need to know after we get vaccinated? What are some things to keep in mind?
Right. So the important things to keep in mind is that, the reported, reactions to the vaccine have been very minimal. Some persons have reported minor pain at the injection site, very low-grade fever, but most of the effects of the vaccine should pass within the first day of the vaccine. After getting the vaccine, it's very important that you get the second dose of the vaccine at the allotted time, which is usually 3 weeks after the first vaccine. And even after becoming vaccinated, it's very important to still socially distance, wear your mask, and wash your hands. Reason for that is that remember that most of the population at this moment is are not vaccinated, so we have to protect the rest of the population amongst us.
And that is so important. I'm glad you kind of emphasized that because a lot of people feel once they get vaccinated, the mask can come off and they can do whatever. So I'm glad that you said that. Now, my brother, he works in a hospital, so he recently got the vaccine, and I posted it online. A lot of people were very concerned. They had a lot to say about that, and they were really worried about the possible side effects that could happen. So what would you say to some of those people who are worried about that?
Right. So, that's even last week, a patient of mine had, contacted me and asked for my opinion. And the side effects are very minimal. I think thus far, I've heard of only 1 or 2 persons that have had major allergic reactions, and major meaning that there is a need for intervention, such as giving epinephrine. But for the most part, the side effects are very minimal. As I had mentioned, usually pain at the injection site, at most a low-grade fever, probably some mild body aches for the first 24 hours. But we have to look at the larger picture because, as you know, the COVID virus has costed a lot of lives here in this country. And I think just a day of slight pain at the injection site, at most a low-grade fever, is a small burden to bear when we're actually trying to get rid of this pandemic, which is so important.
Yeah, definitely is. Now, you say that the goal is to get about 70% of the population vaccinated, but for certain groups, you say it's really important to make sure that they get vaccinated. What groups are we talking about?
So I think, for probably individuals with comorbidities, definitely 65 years or older. If you do have underlying lung disease, such as COPD, also if you're a hypertensive patient, diabetic patient, those patients should really try to, are at greater risk for the disease and should try to get vaccinated. And I'm hoping that once, we have the initial phase of vaccinations, that we'll then be able to vaccinate the rest of the public who are at risk.
Mm-hmm. Now, what other tips do you have in order to help keep us safe?
Right. So in terms of, while we're waiting to get ourselves vaccinated, very, very important to remember the importance of social distancing. I know we're all fatigued at this point. We're 8-9 months into this pandemic, but we cannot let our guard down. We're seeing the finish line, and it's a little bit of a ways off before we get the entire population vaccinated. But please, I emphasize socially distancing, wearing your mask, washing your hands, and being very mindful of your surroundings to make sure that you're not putting yourself at risk.
Doctor, such great tips right there. I want to thank you so much for coming on and sharing that information with us.
Thank you very much. Have a good morning.
Yeah, you too. Well, still ahead, our Kelsey Fabian is live with some fun and